ready to move around to our penultimate presentation from our very own Yitzy David.
Hello, everybody, and I hope you're all enjoying this Innovative Summit. It has been quite an experience. I had the pleasure of being part of the in-person day one events, which were absolutely educational and very informative. I'm going to talk today about the upcoming trends within digital health, but also talking about something very important within all of the aspects of digital health, and that's engagement. My name is Yitzy David. I am the principal of YJ&M Group, LLC, which is a nursing consulting service. We also own several other businesses in various spaces, including baby retail, financial services for small business, as well as an investment portfolio that includes investments in health startups. I'm also the editor-in-chief for HITLAB's website, and I personally manage the content that going on to the HITLAB blog every couple of days. So just as I'm waiting for the presentation, I am going to get started. So one of the key things that we need to understand about digital health is the progression of the last 10 years, right? The pandemic really saw an acceleration of digital health, but we really want to focus on what came before the pandemic. You know, the pandemic saw the acceleration, but before the pandemic, we had engagement, but not sincere engagement by end users, which are patients, consumers. Studies have shown that there's been an unequal distribution of technology amongst many of the various age groups and socio-demographic groups in the United States. And we saw a higher rate of digital health use amongst patients that were in their 50s and mostly male. But, we didn't see a lot of engagement with, younger generations or with older generations for that matter. Since the pandemic, we've seen an explosive investment within digital health to the tune of $29.1 billion as of 2020. We've seen, the number of deals and acquisitions by companies more than double. We've also seen greater interaction between end users, which are, individuals like myself or yourself, wherever you may be, with your medical records, with your, treating physician via chats. We've also seen greater engagement with our own individual health through wearables, such as like your iWatch. Technology has really, really driven some unbelievable evolution in the last 2 years alone. We're seeing incorporation now of nanosensors in tech, but there's one small component that's also increasing engagement, and that's self-service capabilities. How often do you check your iWatch? You want to see how many steps you've moved, or you can now look at your own heart rate with your iWatch. There are companies now that are able to scan your radial pulse and get a complete synopsis of what your heart looks like. There's a company called Live One that developed a new technology that is now, light years ahead of the iWatch, believe it or not. But what we really need to also focus on is, end user education, end user engagement. There are so many touch points within the healthcare ecosystem that we have yet to capitalize on that have really caused a conundrum amongst developers, amongst big companies to try and identify mechanisms to capitalize on that. We want to improve patient and consumer health, obviously, but also to help, understand trends in a much more much more finer detail. There's now incorporation of artificial intelligence and machine learning. There's a company called Medicor, which has now just come out with an AI platform to engage patients to help prevent, unnecessary trips to the ER. And it interacts with patients trying to identify, their symptoms and provide differential diagnosis and suggestions for treatments of care. We've seen an explosion in women's health tech and for more affordable reproductive health. and from, and for a more holistic approach towards mother and baby, and really moving the needle towards the consumer and really putting them in control of their own health journey, which is an unbelievable, change in the last 2.5, 3 years since the pandemic. And, so what I also want to communicate with our audience today is the engagement doesn't necessarily have to be as a consumer. There's ways for now for the individual to be investing into this type of technology through through means of crowdfunding websites, through Kickstarter campaigns. There's really a whole lot of new ways to interact with startups, not as necessarily as an employee, but also as not as an investor and a consumer. The consumer is really moving the healthcare experience to a much more retail style interaction, where companies are seeing this and are trying to create experiences that capture the more important aspects of your individual lives through data that you may provide to them, and through the way you interact with the various healthcare products. So it's really a wide world of new thinking and of evolution in technology that is really driving digital health and encouraging people to become more engaged with their own healthcare journey. So from kids that are 18 years old on Instagram interacting with influencers to senior citizens and more mature adults that are well within their 80s, to interact with health tech and through smartphones. Personal anecdote: my grandmother, she's 86 years old, and she just got a smartphone for the first time in her life. And this is a woman who's never even had internet connection in her home. So there's really a wide increase amongst not just global populations, but also community populations that we don't realize that are beginning to interact with the larger ecosystem within healthcare. And it's really a very interesting time to see the development and continued evolution that we are now pushing towards as we move forward beyond the pandemic and into the next several years and decades.